Thanks. Simron, do you want to do a brief intro, and then I'll introduce our team?
Sure. So welcome everybody. So for those of you who haven't met, I'm Simron Singh. I'm a medical oncologist at Sunnybrook and the new wellness lead for the Department of Medicine. So we've pivoted these rounds quite quickly just to be able to have an open discussion about wellness, about burnout. You know, this has been a very difficult time for all of us, faculty and learners. It's been a very long year, and wellness, moral distress, and burnout are really more relevant than ever. There's been elements this year of fatigue, of personal challenges, and how the pandemic is affecting our families, our friends. People have children at home doing virtual schooling or arranging for vaccines for our parents, a number of other personal issues. But wave 3 is, I think, hit us particularly hard. It's been tired and exhausting, but there's been some new elements, and that includes potentially some guilt over the care that we're providing. You know, we're facing triage decisions right in the face, and many of us are uncomfortable with quality of care. We've adapted to virtual care, but it hasn't always been ideal. And I think one of the issues is there's a fair amount of uncertainty of what's to come. And I certainly feel personally that that's been a big issue for me, is how bad is this going to get? So we wanted to have a discussion today about some of these issues. Andre Picard, in one of his recent editorials, quoted Dan Gardner, who talked about monsters are scary, but not knowing if there is a monster is scarier. And I certainly think many of us are feeling that right now. So given these events, we thought we'd bring together faculty and learners to have an open discussion about some of these issues, to support each other the best we can. And this would act as much of a peer support as much as it is an information session. We want to have an open discussion. Of course, just a reminder, this is the initial part of this is going to be recorded. The question and answer period won't be recorded, so we can have a discussion where you can ask questions that you may not feel comfortable with. But again, reminding in these forums, we want to have a respectful discussion, respect each other, respect the diversity of our opinions and of our individuals, and go from there. So I'm going to hand it over to Lisa, who many know is the vice chair for culture and inclusion, and to talk about the team that she's created. That this work all predated COVID. Lisa.
Thank you so much, Simron, and welcome to everyone. And I'm so grateful to the whole team here because of the ability to quickly adapt. And as we hear about what you're talking about, Simron, around the specific context that we're in right now, and how I think many of us are feeling like the fuel is really low and we haven't had a chance to replenish. We wanted to ensure that we were being responsive. And that sort of responsive leadership is what I've seen very much among our hospital leaders in our department, but also among our own Department of Medicine leadership in Dr. Hawker. So grateful for that and for this ability to adapt quickly. The Culture and Inclusion portfolio adapted, it was created well over a year ago, emerging from the results of the faculty survey. And thank you to all of you who did fill it out, in which we realized that we had done so much work in the space of equity and mentorship, but that we wanted to pull it all together to focus on really what is this culture of our department, where everyone will feel that they are respected for who they are and are able to speak up and voice their concerns and feel supported in that. And in that piece, to also feel like they are supported in their whole person, and that they can be, their wellness and their well-being and the well-being of their family and their community also matters. So this did predate COVID, and how prescient in a way to have a portfolio where thinking about a culture where we are all supporting one another, respecting one another, has become so clearly needed in the context of a global pandemic where so many of us have been pushed to the limits. It has three different portfolios initially. So, and I'm going to introduce each of the leads. Dr. Simron Singh, who's leading these rounds and moderating, is the lead for wellness. He's a medical oncologist with great experience in this space, particularly around structural and system level changes to support well-being. And we're excited to have him in the role. Secondly, in the role of equity, really building on all of the work that she's done around mentorship for IM CWMGs, as a medical educator and as a lauded teacher, is Dr. Umberin Najeeb, who is the lead for equity. And her plan is to really infuse the lens of equity in everything that we do in all of our policies and processes in the department, building on the amazing work that's already been done. Thirdly is Dr. Catherine Yu, who is the mentorship lead. And unfortunately, Catherine is unable to be here. Catherine is an endocrinologist based at St. Mike's, has tremendous expertise around knowledge translation, specifically related to diabetes. And for her work, the opportunity to take all of the work that we've already done around mentorship and share it more broadly with you. So really building on her expertise as a knowledge translator. We also have added several roles. Dr. Eric Cohen, who is a cardiologist at Sunnybrook, who brings his many layers of expertise to the work, but his specific focus will actually be on transitions. In our transitions as faculty members, we're calling them late career transitions, but Eric, when we focus on those specific transitions to retirement, or when one has illness, for example, and has to change your position, we know there will be a lot of learnings that will apply to other portfolios. And last but not least is Dr. Mirei Norris, who will be in both the culture and inclusion and in the education portfolio. And Mirei, we're so thrilled to have as an amazing Black health leader. She's a geriatrician, also based at Sunnybrook, and is leading the Black and Indigenous learner recruitment and mentorship pathway. As you know, we've developed a specific CARMS pathway to support recruitment of Black and Indigenous learners. We've successfully recruited several to our program. We're so thrilled, and Mirei is leading that work. So with that amazing team going forward to support you, we are going to now launch into the focus of the rounds, which is on how to support what you need to know right now to get by. So I'm going to throw it back to you, Simron.
Thank you, Lisa. Thanks very much. So what we're going to do today is we're going to have a bit of an update on wave 3. Then we're going to talk about some strategies that we may be able to use to deal with the uncertainty and to deal with the stress of this pandemic. And then finally, an update about the work being done at the Department of Medicine. And then, of course, we'll set into question and answers. So to start, for an update on wave 3, we're really lucky that Isaac Bogoch and Jerome Leis have both joined us today. I think most people should know them. They're both associate professors. Isaac, of course, has been very active on Twitter and other media platforms, helping inform the public about what's happening. He's at UHN. Jerome has been a star for us here at Sunnybrook, working tirelessly and endlessly to keep us safe and keep us informed. The entire Sunnybrook has been appreciative of the work he's doing here as the medical director for IPAC. I also found out Isaac is from Calgary, so I'm really hoping he's not a Calgary Flames fan, but we won't hold that against him today. So Isaac, do you want to start?
Sure thing. Thanks so much for the introduction. I'm not on mute, so I haven't made that embarrassing gaffe just yet, but it's coming. Great to see everybody. I know we're talking about wellness, so under the umbrella of wellness, let me tell you how terrible the third wave is and how bad it's going to be. Sorry about that, but just call it how it is. You don't have to look too far to see how devastating this third wave is. I mean, not every day you've got adults admitted to pediatric intensive care units, or you're helicoptering patients 200 kilometers away to ICUs, or you're calling in healthcare professionals from other provinces to help you with your all hands on deck approach, or you're canceling surgeries. Like, by every metric, we're in trouble. It is the way it is. It didn't have to be this way, but here we are. Is there a light at the end of the tunnel? The answer is overwhelmingly yes. Even though you can't see it, it's really there. If you look at growth rate of COVID-19 cases in the province day after day, they're actually slowing down. It is now about 2 weeks after the Easter holiday. We've had our spike. We're still in trouble. It's just doesn't appear to be getting worse and worse and worse in terms of the number of new cases per day. We're probably leveling off. That doesn't mean we're in the clear. You still can't digest 4,000 new cases per day and expect your healthcare system to function effectively. Even when we're on the downside of the curve, you can't expect your healthcare system to function effectively with 3,000 or 2,000 new cases per day. But at some point, you have to crest and come down the other side of the mountain. And it looks like we're probably cresting and coming down the other side of the mountain. I know it's been very frustrating to see the gulf between what the science table has recommended and what the government has actually done. And, you know, at least there has been some movement recently and steps in the positive direction that the government is taking to get this under control. Credit where credit's due, but also criticism where criticism's due. A lot of this could have been prevented and it wasn't, but here we are. So let's get out of it. We know that they are working on a program. I made a little sticky note here. We've got paid sick leave that will probably be announced. How good is it going to be? I have no idea, but we know that they're working on this. We know that they're moving more vaccine into high burden areas. Is it going to be enough? Yet to be determined, but it's happening. We know that they're prolonging the stay-at-home order. That will really help. We know that they're taking definitive actions by closing playgrounds, which of course will, terrible. We shouldn't be closing playgrounds, pardon me, forget that one. So, obviously there's some things that are helping and other things that aren't helping as much with public voices and outcry, I think, and private behind the scenes advocating as well. I think we can actually get them to do the right thing and we'll come out of this mess. Not unscathed, clearly not unscathed. I'm going to pivot for a couple of minutes to talk about vaccines and hand it over to my dear friend and colleague, Jerome. Depending on who you ask, the vaccine, if you ask the government, the vaccine program is working splendidly. If you ask some of our colleagues here, the vaccine program is a complete disaster. And of course, the truth lies somewhere in the middle. There are some things that are going well. There, of course, are other things that need improvement. You can't deny that more days than not, Ontario is vaccinating over 100,000 people per day. Yesterday, they vaccinated 136,000 people. That was a record. We've never vaccinated that many people. If you want to be comparable to the rates of vaccination in the United States, you've got to be at about 140 to 148, technically, thousand vaccines per day. So that's a pretty impressive rate. A lot of it is driven by some supply issues, but of course we're now mobilizing AstraZeneca a lot faster, that we've lowered the age category so we don't just have a big lump of coal of AstraZeneca sitting there. And yes, as of yesterday and the day before, we really started mobilizing that vaccine, and that's why our rates have gone up. We have seen some serious issues with equity in terms of the vaccine rollout. However, when we look at the ISIS data, we can see that gulf is actually being narrowed. And we are seeing those pop up and mobile clinics going into those high burden areas, and not just going to the high burden areas, but actually putting the right needles into the right arms. You're going to Jane and Finch, you're going to the BAP Temple, you're going to Iqbal's Fine Foods, you're going knocking on doors in high density urban housing areas and giving people their vaccine who would otherwise have significant barriers to getting vaccine. Is it perfect? Far from it. Is the sign-up system convoluted? The worst. But yet we still continue to vaccinate. The pace continues to go up, and more the right people are getting vaccinations. So I think that it's just fair to have an honest look at it. We can't say that it's all perfect, but on the other hand, it's not all doom and gloom. The pace of vaccination is truly picking up by any metric. And, this first dose fast approach is probably a really good approach for most, but not for everybody. We can talk about some of those details later, but I'd really like to give Jerome an opportunity to have a chat. Thank you so much.
Thanks, Isaac. Jerome?
Thank you. Good afternoon, everyone. Pleasure to be here. I have to admit that when I mentioned briefly to my wife that I was on a wellness panel, she actually just burst out laughing. If that tells you anything about what kind of role model I am in the wellness department. But I will just add a few comments to Isaac's excellent summary. Obviously, I agree it's going to get worse before it gets better. I think that from a healthcare standpoint and from an IPAC perspective, we're certainly looking at the numbers in terms of the critical care increases, and that's where we're probably the scariest signs exist. You're seeing sort of a 3 to 5% increase in the COVID critical care beds, right now. And as Isaac mentioned, although things will eventually get better and maybe community rates, might improve. Those are the lead indicators. But until the lead indicators improve, the lag indicators in terms of ICU admissions and inpatient beds are going to continue to worsen. So between now and first week of May and probably into around the May 8th to 10th range, I would say that we're going to continue to see a very significant pressure in terms of our healthcare capacity. We know we're at about 740 critical care COVID patients in the province. We know we're going to go above 1,000. Will we hit 1,500? that remains to be seen. But I think for the next few weeks, it's going to be certainly the most challenging period that we have certainly encountered. Having said all that, one of the things that I do want to say is, I think there's a lot of the right things that are happening at a system level to prepare for this. As scary as it is, there's a lot of movement happening. There's ALC patients moving, out of hospital, and certainly a lot of collaboration happening with the LIN in terms of filling and optimizing long-term care beds. That's a huge, very important piece of work. Critical care capacity we're seeing across our hospitals. We're increasing our capacity and looking at both the use of conventional and unconventional spaces for critical care beds. And obviously, we're going to be using unconventional spaces, not necessarily for critical care initially, but people may be aware that we've got a mobile health unit at Sunnybrook, and there are others around where we're actually going to be looking after patients literally in a tent. And so this is going to be a challenging few weeks. In terms of one reflection I wanted to sort of make is that as we do this, and as we go through this really, really difficult period, I think that we have implemented many different layers of protection in our planning and in our practices. We've got all of our IPAC practices that we've put in place. We also have vaccination as an additional layer in our healthcare capacity, and I think we have amazing teams, physician teams, but all of our other teams that I think will really come together and be able to meet the need. And I think, the staff redeployment that's happening across all of our organizations, I think is going to be, vital to being able to care for all of these patients as they come through. Things will eventually get better, but it's going to be challenging. There's no doubt. And I don't think you can really sugarcoat the next few weeks and how challenging it is going to be. One last reflection I had, related to more wellness, and it's come up a lot over the pandemic, but it's been very acute the last several weeks. And Isaac alluded to, the science table making recommendations, other decisions being made, and certainly it's been very challenging. I can speak honestly to say that there's been moments of intense frustration. Probably we've all experienced these emotions, and I think that's very normal. One of the things that has helped me is to try to really identify the things that are within my control, the things that I can do, and that's where I put my focus. I feel like at this time where there's going to be such intense demand placed on all of us, we can't afford to be losing energy on things we can't control. And so I think it's an important, reflection, and hopefully all of us, whether we're caring for COVID patients or we're caring for all the very important patients that don't have COVID that still need essential care. We all have things that we can be doing. Some of us will probably go into roles that we haven't done before. Some of us will volunteer to work in the mobile health unit, or, perhaps help out with more critically ill patients, even though it's sort of stretching our skill set. We all have things that we can contribute that are within our control. And so I think that's going to help. That's going to get us through this.
Thank you very much, both Isaac and Jerome. Isaac, do you want to say something else?
May I add just one quick thing? I know we're a little bit over time. I think the other take-home point too, and thanks, Jerome, that's fantastic. Just to remember too, to help over the next couple of weeks that are just going to stink by any measure, is this actually gets better. Like, the short-term forecast is terrible. We all know that. But the midterm and the long-term forecast is great. It actually is. Vaccines are rolling out. This wave will come to an end. The vaccines really, really work, even against the variants of concern. They protect you from getting sick and dying. Like, they're really good. We've seen what happens in other countries where they've had successful mass vaccine campaigns, and they're starting to slide on that scale towards normalcy. That's going to be us. We're just a couple of months behind. We'll get there. And the medium and long-term forecasts actually look really, really good. We just have to get through the next few weeks.
Thank you very much, Isaac, for that, and both of you for your honest assessments, and as well as for your outlooks. I think that really rests well with all the faculty to really understand your thoughts. You're both very well respected. Jerome, your last comment is a great lead-in for our next speaker, is about doing things that we have control over. Dr. Roger McIntyre is a professor of psychiatry and pharmacology at the U of T, and he's the head of the mood disorders psychopharmacology unit. Myself and a few other people from our team heard him on CBC radio talking about some of these issues, and it was very relatable, and certainly we thought he had a lot of valuable information. So we've asked him to join us today to talk a little bit about this unpredictable stress and strategies. So Roger, over to you. Thank you for joining us.
Thanks for having me. Quick sound check. I'm not on mute. You can hear me okay?
Yes, we can hear you.
Okay, good stuff. Look, great to be here speaking about this topic. And you know, what I've been hearing so far is, in fact, concise, accurate information, which we're going to get into in a moment, on how that's the antidote to chronic unpredictable stress. So CUS makes us all cuss. We don't like it. And my theme here is that what this situation has really instantiated, the COVID-19 situation, is what in the lab has been well documented, that is the deleterious effects of chronic unpredictable stress. I'll walk through just a couple of slides with you, just put a little bit of science to this on how this is affecting the brain in our general population and what we can do about it. So let's, in fact, if we can, just address a couple of key points. If we were to stand on any street in Canada and we ask people any of these questions, I'm sure you're going to get a robust yes. People feel tired, they're fatigued, amotivated, they've got brain fog, they have no joie de vivre. People may not be mentally ill, some are, but we're not talking about that. We're not talking about people who've declared mental illness. We're talking about people who are languishing and are just not well. I'm going to say a couple of words on the impact of chronic unpredictable stress on our ability to think, and as well on our reward function. So when we talk about the Fab Four, some people think about the Beatles, but the Fab Four in my world is listed on this screen. These are the four domains of cognition. They're covalently bonded, but they're all very, very different. And when we look at animals in our models, and we've done this work, and or we look at human subjects, and we subject them to stress, it decreases performance across the Fab Four. If we subject them to chronic unpredictable stress, we don't know when the grief is going to end, and or the grief just seems to be unpredictable, the detrimental effects on the Fab Four are even more pronounced. Brain fog is a subjective experience, and to some extent, it does map on to objective measures. Let's say a little bit about reward, because the future always intrudes on the present. And much of what we do in life is, yes, experiencing pleasure. Some of you right now may be having a bowl of soup and a sandwich, and that's consummatory pleasure. Some of you are looking forward to seeing a friend or looking forward to events of the future. The futuristic, the anticipatory pleasure is greatly affected during COVID. Now, I want you to think of pleasure in three ways. We experience pleasure, we anticipate pleasure, and we predict pleasure. Now, what Isaac talked about is bang on. We need concise information, more on that in a moment. But what Isaac said is that things will get better. That assumes that the listener has an intact reward prediction ability. In other words, why so many people feel so blah, feel so tired, feel so lack of motivation is because they're compromised in the reward prediction effect, the anticipatory of pleasure. And when we subject animals to chronic stress, this is greatly affected. When we subject them to chronic unpredictable stress, it's even worse. Let me just show you a couple of slides from some recent studies in this area, just to make a point. I want to draw your attention to 12 o'clock noon on the slide. This is brain trophic factor. This is taking animals and subjected them to CUMS. I apologize for the acronym, but that's chronic unpredictable mild stress. This is the best way to result in apoptosis of neuronal tissue as well as glial tissue, not only in our animals, but also in human beings. One of the most highly replicated findings. And that translates into this slide, just draw your attention to CUMS. You see this significant attenuation of progenitor molecules for, in fact, brain cells, both gray and white matter. The point I wanted to leave you with is that this is not just some transient subjective phenomenon. This is a phenomenon that maps onto highly replicated and in some cases irreversible changes to cognitive control systems and reward systems. Let me draw your attention to 11 p.m. on this slide. The red line denotes what happens when inflammation systems are activated. So if you want to activate inflammation in human subjects, one of the most robust way to do so in our stress paradigms that we do is to subject them to unpredictable stress. That increases a variety of species in the inflammatory cascades, and that results in an attenuation of the reward system. In this case, the insula, which is part of the salience network. Let me park there for a moment. COVID-19 has gone on for 13 months. 13 months with no clear finish line. And in fact, the finish line keeps changing, it appears. And that is heard by the population as unpredictable. And that unpredictability adds to the chronic stress, because chronic stress and chronic unpredictable stress both have deleterious effects on cognitive control networks and reward networks. Is it a fait accompli? Is it a done deal? No. It is important, however, to state that many people, because of the stressor of this, that is the effect at the brain circuit and brain network level, unfortunately are predisposed to go on to have medical illness like major depressive disorder. The good news is that most will not. And there's tremendous amenability to the system here. So what I've listed here are two ways wherein we can really work against this unpredictable stress. Now, I'm not going to say too much about collective agency. By the way, this vocabulary is really, agency is polysemous. It has many different definitions and many different languages to it, but in the spirit of the supernova of cognitive therapy known as Albert Bandura, who spoke about social cognition and how we think in a broader socio-spatial context. Personal agency is the degree to which we exert control over our environment. Collective agency refers to the degree to which our environment exerts effects on us. I'll start with the latter. It has been shown, and Isaac, in fact, modeled this for us, that when you provide accurate and concise information, that reduces the hazards of unpredictable stress. And this has been shown in a variety of human subjects. It's also known that when you provide financial provisions, reduce income insecurity, financial insecurity, and other forms of insecurity, that's also been shown to reduce the hazards of unpredictable stress. I want to focus more on the personal agency, and then I'll finish. The personal agency is what you learned when you were an adolescent. You need structure to your day. The brain likes structure. The brain likes predictability. That means, yes, getting to sleep, exercising, all that good stuff, having a good diet. Portion control is something we're hearing lots about, not just on food and alcohol, but one of my good colleagues, in fact, told us we have to have portion control on social media, because social media, when consumed at its extremes, has been known to be highly anxiogenic and, in fact, creates a cascade of events for people that often exacerbates depression, negativistic thinking, rumination, and loneliness. So portion control across the board. Other techniques which are more cognitive in nature include aspects of thought blocking and thought distraction, and it is what it is. You simply try to distract yourself, focus on other affairs. A second tactic is immersion. Find a task you enjoy, immerse yourself in it, and enjoy it. Activate the reward system and the cognitive control system. There's also another very clever cognitive technique called temporal distancing. In other words, it's April of 2021. Isaac's right. This will be over, and we look very much forward to that. Imagine yourself in June of 2022. Maybe you'll be in Bali somewhere with a nice drink. Write yourself a letter as though you're writing yourself the letter in June of 2022. Now, quite frankly, my research is all in psychopharmacology and neuroscience. And when I heard some of these tactics 15 years ago, I thought, really? Does that really work? That seems a little on the soft side, but actually it all works. And it's very robust in its ability to serve as an antidote to this incredible malignancy of chronic unpredictable stress. So Isaac's right. Collective agency is not perfect here, but we're going in the right direction. And we've seen modeled by Isaac the importance of accurate information for the people. Because when you have an erosion of trust in the information provided, it only exacerbates the unpredictability. The personal agency is within our control, and study after study has shown this. And who does this the best? The military. And the military knows full well what it's like to go into an ecosystem of unpredictable stress. And the way they try to approach that is to bring personal agency to the individual in that ecosystem with some of the strategies that I described. So I'll stop there and leave it open for any questions.
Pardon me. That was great. Thank you so much, Roger. So we're going to have questions at the end, but I certainly took some notes on things that I've learned for sure from your talk. So as we've been hearing, the issues of wellness and burnout, they're very complex ones, and certainly they predated COVID. They've been exacerbated at COVID and brought to the forefront. The reason they're so complex is there's so many levels to them, as we've already heard today somewhat, is, we think of things in an individual level, how we personally can affect our wellness and our well-being during these very difficult times. But there's institutional level challenges, and Jerome had sort of alluded to some of those. And there's system level challenges that we've been facing before, but we continue to face during COVID as well, whether that be things that Isaac was talking about, the frustrations we may have with how the translation between the science table and the government has gone, or how we are functioning as a system. They've put challenges on us as individuals. I really like Jerome's comment about some things we have control over and some things we don't. And I think that's the same thing with wellness and burnout. There's things that we have control over, and there's some things that we don't, but we can certainly advocate for. There's not a lot of easy solutions, but certainly the Department of Medicine is working hard well before COVID to try to understand how we can improve wellness and how we can decrease rates of burnout among our faculty and learners. So I'm going to ask Gillian, our chair of the Department of Medicine, to talk to us a little bit about some of the things the Department of Medicine is doing.
Thank you, Simron. I'm just going to share slides. And please let me know if you can see my slides.
Yes, we can.
Okay. I just need to launch. Hang on. Yes, you can see them. So I don't want to get in the way of too many questions, but I'm just blown away by the wonderful people we have in our department and what you've just heard. I think all of us are feeling exactly the way Jerome and Roger and others have described. I'm certainly not functioning at my usual level. And I know that none of you have had a holiday in over a year, and it shows. The brain fog, the COVID fog. Karen Burns emailed me last week and said she felt numb, and I think that many of us are feeling numb, especially those who are witnessing the high numbers of patients coming in. So I just want to start by acknowledging that I don't expect any of you are feeling normal and upbeat and productive. You are feeling slowed, and I know, as I am, every foot in front of the previous foot is an effort. And we've already heard a little bit about Peter Uni, a member of our department, and what happened on Friday. I don't know about you, but when I listened to Peter say that this was the darkest day in his personal and professional career, and was moved to tears. I was moved to tears, but he was also moved to tears. I think he spoke for the whole medical profession, really, in terms of articulating how hard everybody has worked, and you have worked, and yet not getting the response that we expect to get from the people who we're advising. And, you know, at the same time, I watched Callie Barrett, also critical care doc in our hospitals at UHN, talk about the huge disparity in the impact of this disease by every social health determinant, and just her anger, her frustration, which again, I think echoes all of you. And I didn't put before pictures on, but believe me, people, we can see it in people's eyes and faces, how exhausted they are. I had the privilege, great privilege on Sunday, spending a few hours at Sinai with Chaim Bell doing a walk around to the ICUs and the medical wards. And I had a nice chat with Lavina Munchie and Christy Lee, who were on separate units, but had no idea that we were admitting so many pregnant women. I had no idea the effect of ECMO on a fetus and the challenges that now OB-GYN and medicine are facing with respect to, well, what do we do about this fetus if the mom needs to be resuscitated? And it's pretty crappy. I met some wonderful nurses, including pediatric nurses who are now working in adult medicine. And we've also got folks now, as was mentioned, in the pediatric hospitals. And I'm so impressed by the camaraderie and the willingness to work and share. While we're suffering, the nurses are suffering more. And there is a huge shortage of critical care ICU nurses. And I was impressed at, I am impressed at how tender and caring you are for the nurses working alongside you, and want to commend you and ask you to continue to remember the people that are working beside you. So all this to say that when we were talking last week about, well, what is the department doing? I rack my brains at what more can we do? You know, it's very hard to try to think of new things that we haven't already sort of thought of that could make things better. There's no magic bullet. And really, I think what's clear to me is what we have is each other. And that is pretty darn incredible, as you've already seen from the people that have already spoken this morning. So I thought that what I would remind you about is the work that's already ongoing, some of which started at the beginning of COVID. This is Julie Maggi, who's the faculty lead for wellness at Temerity Faculty of Medicine. There are many resources. They are on our website, but I wanted to remind you, but importantly, there's also a faculty resource navigation line that is available to you should you just not sure what you need, or if you just need to speak to somebody. It's being personed by a social worker who really is a great person to talk to. So I want to remind you that those resources are there. But this is what the department has been up to before COVID and since COVID. I really want to call out and commend PGME, Arno Kumagai, Sarah Jung, Jeanette Gogan, and all of the many people who've worked hard to redeploy folks from other departments to support medicine. Thank you to our particularly family medicine, psychiatry, who have been at our sides, and increasingly anesthesia and surgery as well. We've done our best to extend flexible or make flexible deadlines. I know people find it hard to believe that, you know, a CFAR deadline is movable, but it's all movable. These are not critical things in the face of a pandemic. And, you know, I think it's important to remember that we don't have to be our most productive selves right now. And all of that can just go. It kind of, I liked what Roger just said about what you can and cannot control. But what we're trying to tell you is that when you don't have the capacity, you don't have the bandwidth to be writing papers or grants or putting together resumes, don't. And we will support you. I think we did have an impact with respect to advocacy with the Royal College and the cancellation of the PGY3 OSCE, and I'm delighted. I'm angry that we weren't successful with others. I'm angry at the Royal College for their excuse for why they canceled it, which is totally tone deaf, but I'm glad it was canceled. Our PICs are working flat out, as are our DDDs. We have site leads for wellness. We've got divisional leads for wellness. And I have seen incredible work and really cool and creative activities that various hospitals have been doing to stay together, to be able to talk to one another. And last week, you heard from many of the hospitals and from us that all non-essential activities should be canceled. We're not going to prescribe what that means. What we're saying to you is, if there's something that really doesn't happen right now, don't do it, so that we can free you up to take care of yourselves and to take care of each other. Yesterday, Moira Capral, very, very smart woman, sent out her newsletter to GIM. And I particularly liked what she said in it, which I will, quote, which is, I know that when we look back on this period, we'll be incredibly proud of everything we've done. So let us press on, do the work for which we've trained and that we do so well. And I just thought that was beautiful, and I would share it more broadly. Thank you, Moira. So I'm gonna, that's my daughter from England calling me. I want to sort of close with reminding you of this, and that is, we've already acknowledged that we're all in this crappy, stinky, horrible pandemic, but it's worse for some. Their pressures are different on different people. We are in the same storm, but not all in the same boat. I am very grateful I have grown-up children right now. I'm not grateful that they're across the world and I can't see them, but I can only imagine what it's like for people with small children at home right now. So I'll remind you, stop non-essential activities so that you can focus on your patients and your loved ones and yourselves. Use the available mental health resources. Please show compassion to others and to yourself. And remember that there are lots of stresses on people beyond the hospitals. Use your PPE, get vaccinated if you haven't already. I've had finally my first AstraZeneca, so I'm happy about that. We're going to resume chair chats starting next week. These are just totally unscheduled, informal sessions where you can talk to me or anybody else you want to talk to. We can bring them in, but just providing you yet again another venue for checking in. And even though I haven't actually seen whether this has been announced, I'm going to end with thanking Lisa, because you will hear today that Lisa is moving on from us as Vice Chair Culture and Inclusion to her new role. And I actually don't know what the title is because it hasn't been formally announced, but I think she's going to be the faculty lead for equity, diversity, and inclusion. Is that it, Lisa? You want to correct me?
Associate Dean of Inclusion and Diversity.
There we go. So in the last year, in the midst of COVID, we have really got a lot to thank Lisa for. She's given us a team of 5 amazing culture and inclusion leads, and we thank her. And I'm going to shut up so we can hear from you. Thanks very much.
Thanks very much, Gillian. So I hope, people do feel supported. There's a number of resources in the chat room that are being shared, including our wellness page that has a number of resources there. Please feel free to use them. So as a reminder, and congratulations to Lisa, now that's officially announced. I think we all congratulate her and thank you for all the work that she's done so far. As we move to the Q&A session, just a reminder, we won't be recording. Please raise your hand or just type it in the chat. We'll try our best to moderate. Again, let's just keep, as always,